In the short time that I have, I'm going to tell you a bit about who I am, but I want to launch in specifically to talk about the idea of teaching well-being, which has been the goal of my research program since its inception. So specifically, I'm going to spend a little bit of time on background to talk about the idea of teaching happiness. We've heard a lot about the importance of happiness, but how can it directly be taught to individuals? I'll also talk a little bit about the idea of getting activities that teach happiness to the general public, which is more difficult than it sounds, and it probably already sounds difficult. So I'll talk a bit about the barriers to doing that. And then I'm going to tell you about Happify, which is an online platform that I helped to create, and how we attempt to tackle all of these issues to bring the science of well-being to the general public, to organizations, one day perhaps to the world. And I'll talk about Happify as kind of a case study for how to do that. Before I get into that, though, let me tell you just a little bit about who I am and my background. I started in a traditional academic path. I went and got my PhD with Martin Seligman, who is right there. And I studied the idea of improving happiness in a traditional research setting. I got involved in, my bad. I got involved in some edited books about the science of improving happiness, and I particularly got my first taste of the idea of spreading happiness in organizations, specifically higher education. So I did some work looking at how to take universities and imbue them with positive psychology, the science of happiness, how to teach positive psychology, and so on. At the same time that I was doing all of that, I was really getting into the idea of technology. You'll see that I'm wearing a Fitbit on my wrist. I love data collection, and so about fitness variables and sleep and all of those things. I also had the good fortune of being able to work with Sonia Lyubomirsky, who I know is here. I'm not sure if she's in the room. There she is. With Sonia Lyubomirsky, who had developed an app called Live Happy. And that was my first taste of the idea of making an app with the science of happiness. I also want to say on a personal note how delighted I am to be here because my family has come with me. This is a picture of my husband and I scuba diving, and we'll go scuba diving later this week. And I train Brazilian Jiu-Jitsu, which I am very excited to train here in one of the, the greatest places in the world to train Jiu-Jitsu. So very excited to be here. Thank you for your attention. Into the meat of my presentation. So there is an established science of well-being that shows it can be reliably taught. Much of that research has been done by the labs of Marty Seligman and Sonia Lyubomirsky, and also some of my own work. So just very quickly, there's evidence, especially in adults, but somewhat in children, that well-being can be taught, that it can be taught to people who are relatively happy to begin with, people who are mildly unhappy, all the way to people who are severely depressed and in the suicidal range. So regardless of how distressed a person is, we seem to be able to improve their well-being using the same activities. To people suffering from schizophrenia, there's some work I've been involved in there. To people who are suffering from chronic health conditions and maybe aren't taking care of their medical needs as well as they could because they feel hopeless. And as well, people from a variety of different ages and cultures. There's been some cross-cultural work, though there needs to be more. So the science of well-being, reasonably confident that well-being can be improved. So how do we do it? Now, there are many techniques, but I'm just going to give you a couple of examples. One technique that is quite easy to teach, quite simple, and doesn't take long to do is savoring. So an example of this would be the amazing dinner I had last night in my hotel room. So lots of interesting flavors I'd never tried before. Getting to sit down and not only eat it slowly, but really pay attention to each component so that I can enjoy every aspect, see how every flavor works together, and really have the most of the experience. This can be done with memories, savoring a wonderful memory, having a good conversation or experience. One can savor almost everything, but we often begin by teaching it with food. Being kind to others, another reliable way to improve well-being. So teaching people to come up with not the things that they always do, but new ways to do something kind for somebody else, new behaviors that they can add to their repertoire to be kind. And the one I'm going to spend a little bit more time on, because it was specifically requested that I do a demonstration of an activity that teaches well-being that's brief, but that you can do right here. I'm going to talk about gratitude, which is expressing your appreciation towards someone or something that has done something good for you. So I would like each of you to pull out either your phone. I know, when does a presentation ever ask you to pull out your phone? But take out your phone, a piece of paper, whatever you prefer to write with. And for the next 3 minutes or so, we're going to do a very brief gratitude activity. Now, what I want you to do is think of somebody who you are grateful to, but who you have never properly expressed your gratitude towards. So you might have said thanks for each individual thing, but you've never taken the time to put that all together and really show them all of the things they've done for you. So take a minute and decide who that would be. Now, once you have that person, I want you to articulate specific reasons why you are grateful to them. Now, if you had 10 or 20 minutes, I'd ask you to write a page or two where you really get into detail about these. But typically, when I do an audience demonstration, I try to make it a little more brief, so we're going to do bullet points. So you're going to write down 3 things, give or take, that you can specifically think of that they've done that have made you feel grateful. And here's the important part. It's not enough to just list what they did. You have to also say what the impact of that behavior was on you. So I'll give you an example. There was a time in graduate school when I was having a really difficult time, and I had to move from one apartment to another. But I was dealing with grief. I was really upset. And my mother was across the country, but she flew across the country and she helped me make that move. Now, to her, that's just what mothers do. She might not have realized that I was very grateful for that. But if I were doing this activity for her, I would say, not only you came and helped me move when I was having a difficult time, but that made me feel taken care of. That made me feel like I could count on somebody in this world, right? So I would say the impact that it had on me in addition to what she did. Okay, so I'm going to give you, can we do it in 60 seconds, 90 seconds? Just take a little bit of time to write down 2 or 3 things towards this person that you felt grateful for and explain just a little bit the impact it had on you. Now, I see a lot of people just sitting here, but I strongly encourage you to try it. It's simple, but deceptively powerful. All right, so we should have, at this point, a bulleted list of a few things that you want to articulate about your gratitude to somebody in your life. Now, here's the important part. Now, the research does suggest that simply taking the time to articulate and write out gratitude is beneficial to well-being. But if you actually take the additional step of then sending that, reading that, in some personalized way, delivering that gratitude to the other person, the effects are more powerful. So I want each of you to think about how you could express what you just wrote, either in its current form or fleshed out a bit more after this talk, how you would be comfortable expressing that. Now, I want to give the caveat that the more personalized it is, the better. So the research does show that if you do it in person and you read it to them, that is definitely a powerful method. People always want to email it. They want to do the less personal thing because it feels more comfortable, but this is one place where going outside your comfort zone is really valuable. So the most in-person, the most personal that you can do, I encourage you to express this to somebody else. Now, I'll show you in a minute how we do an activity like this on Happify. It's not the same as sitting in a room and going through it step by step. But now you have a baseline for what the kinds of activities look like that Happify is based on, so you can appreciate how we translated it for implementation purposes. When it comes to pretty much all areas of mental health, there is an implementation problem, meaning that there are many good research-based programs and they are not reaching the general public. They are sitting in file drawers. They are being given to small subsets of people who happen to be in the right geographical area, who happen to be able to afford it. It's very difficult to get the amount of mental health help that is needed in the world actually out there in the amounts that it's needed. That's true of everything. I'm going to focus, obviously, on well-being. But I want to talk about a couple of factors that make it difficult to get well-being science to the general public. One is cost. So I know when I first started studying this, I was doing my work in person. So I'd have groups of 12 people come and meet with me. And at that time, I was a master's level student, and I was teaching this, and we would have 6 to 8 sessions in person. And that's a relatively common model. But if you think about it, having people have to physically come to you, having somebody who's trained to actually give this intervention, and only helping 12 people at a time is very difficult to scale up to a whole university, organization, country. It would be a challenge. So technology became very interesting to me when I started thinking about cost. Engagement, and that's where the gamification piece comes in, is also a challenge, because in order to be effective, a platform needs to win out over Netflix, email, family, hobbies, everything that you're doing in your life. Somehow you have to choose to do this instead of all of those other things. So engagement is essential. People have to actually want to do it in a self-driven way. Scientific grounding, right? It's easy for science to get lost in translation when it's put into a real-world product. So all the happiness science people in here can probably count beyond their fingers times that they've downloaded an app out of curiosity and looked at it and been like, that's not really what the science of mindfulness says. You know, it's not quite right. So staying true to the science can be a challenge. And stigma can also be an issue. So although I would say that mental health-wise, probably one of the most prevalent mental health issues is depression, labeling things as depression can be quite off-putting. So programs that are about depression aren't necessarily appealing to people, even if they need them. They might not be drawn towards a program that is talking about depression. So the idea of focusing on well-being, it can be very appealing, because we're starting to see more and more data that shows that you can reduce depression without ever talking about it, by doing things like this gratitude activity, which is extremely powerful among depressed people, by the way. To do these types of activities that really don't talk about depression at all, yet have significant effects on depression, can skip this stigma issue. So already, the science of well-being is able to sidestep some of these things, especially the stigma problem, but one must consider whenever trying to think about how to implement a science of behavioral change, that these things are considered. So Happify came about because I was speaking at a positive psychology conference in 2011, and I was talking about my own dissertation research, where we had created a website where people could learn positive psychology activities, so things like what I just showed you. Savoring was on there, gratitude was on there. And we had spent a lot of time and energy and money making this website, but the retention was just terrible. It was really hard to get people onto the site, and it was the best we could do. It was the best we knew how to do, because we weren't experts in gamification. We weren't experts in engagement. We were researchers. And so I was frustrated by that, because although the data looked good, the results looked good, we didn't have the kind of reach that I had hoped, right? The point of making a web-based application is so that more people can reach it. But if people aren't reaching it, that's an issue. So I was frustrated about that. And in the audience were 2 entrepreneurs who had spent their careers selling those kinds of games on smartphones that are really addictive but have no real purpose. You know the games I'm talking about, the Candy Crush and Farmville, these very highly engaging games that don't help people, but they're very entertaining. So they were in the audience thinking, well, we know how to make things engaging, but we don't know what to engage people with. Could we engage people with something better that would help them? I don't know what it would be, but that's what they wanted to do. And here I was talking about exactly what they would want to teach people. So we ended up talking and coming up with this idea of Happify and creating it, which we launched in 2013. So I want to show you a bit about Happify. This image here is how we organized all of the different scientifically based activities that improve well-being. And I'll show you just a little bit about what we do and how we do it so that you can see how what could be just a bunch of instructions, right? What I showed you before, here's how you savor, go savor. Instead, turning it into something interactive. So we use cutting-edge engagement principles to retain users. Again, this is not my expertise, but that's what the entrepreneurs I teamed up with brought to the table. Because I was involved from the beginning, I was a consultant at first, it closely follows what the science says about how to teach well-being. At every stage, I was looking at what they were saying and making sure that it fit with what the research had found. And it's not just research-based. It's research generating. Now, I don't have any time today to tell you about this, though I'm happy to after the talk. But in addition to everything on the site being based on science, we actually do science to make sure that our platform is working the way we expected, which is rare but important, right? It's important to make sure that how we're doing it, it's still effective. Now, we also have a way of tracking outcomes, which seems obvious, but it's important. How are we going to know if we're helping people if we don't have some way that's reliable to test them? How would you ever test a weight loss program if you didn't have a scale? Right? You don't know if people are losing weight. You can guess, but you need a measurement. And we're also, the kinds of science that we're doing, we're looking at general users, so people who just show up on the platform, but also people with all kinds of different the kinds of things I talked about before, people with chronic illnesses, people with clinical depression. Again, something I'm happy to talk about in lots of depth later. And we're also getting into some physiological outcomes, which is really exciting, looking at things like if we have somebody who has diabetes or a study of people with diabetes, how well is their diabetes actually being managed, looking at their HbA1c levels. So some very exciting stuff there. Now, I just want to show you a really quick clip that walks through the aspects of our platform, and you'll see as you watch how we are able to eliminate the human feature, right? They don't have to talk, our users don't have to talk to a person real time, ever. There's a pretty good amount of research to suggest that that reduces efficacy less than you would think. You can learn a lot from a computer, that it has many engagement elements designed to keep people going. It draws on the science, and it's about well-being. Okay. So this is our baseline assessment. This is just gathering demographic variables so that we can do good analyses. We provide recommendations to users that are personalized to help them feel like the program is specifically for them and their concerns. We not only have science-based activities like the ones I told you about in the presentation, but also science-based games. So you'll see some examples of those in a minute, where a person is actually learning to pay more attention to positive stimuli, learning to regulate their heart rate variability. And they're able to do that. This is an example of that attention retraining game. So people are learning to retrain their attention towards positive words, which in lab studies we're starting to see actually impacts their attention in general. They have different types of programs that they can use depending on what they're interested in. So if they particularly want to work around bonding with their kids, there are programs specific to that, or work. There are programs specific to finding meaning in work and so on. And they get to see their outcomes over time. They get to interact with forums, with other people who are doing the same activities, who can see what they've been doing, and they can see what their friends have been doing. And then we have the ability for people to just pick up their phone and outside of a formal program, just do activities on the fly for a quick boost. We can do this on the computer or on smartphone. We have both Apple and iPhone capabilities. So This program, this platform came together in 2013. We have over 3.5 million users. So it's come a long way in terms of reach, though obviously in the scale of the global population, we still have some work to do. I'll end just very quickly to kind of come back to the theme of why we would want to spread the science of happiness to the general public. And part of that is that research shows that happiness begets happiness. If you are happy, the people who you interact with on a day-to-day basis, this is a really cool study that found that happiness is essentially contagious. So when one seeks to improve happiness in an organization or a country, there is this process of contagion that makes that even more possible. People can improve their own individual well-beings, and that not only is helpful to them, but it's also helpful to those around them. So it's very valuable to think about ways to get this science to as many people as possible for the benefit of everybody around them in addition to themselves. Thank you.